Okay. Today's topic is about spirochetes, is about infections that are caused by a group of bacteria that we call spirochetes. And this group of bacteria has one common feature. This group of bacteria has one common feature, and specifically it is spiral shape. As well as you could remember, we have permanent and non-permanent structures of bacterial cell, and one of these structures is flagellum. Flagella's function is motility, is movement. And according to the position of the flagellum, we have different types of bacteria. We have monotrichus, is with one flagellum. We have amphitrichus, is bacteria with flagellum on two poles. And if you will observe, when we are talking about motile bacteria, most of them are rod-shaped bacteria. So we have two edges, two poles of bacteria. If it is monotrichus, the flagella will be situated on one pole. If it is amphitrichus, flagella will be situated in both poles. So it can be two bunches of flagellum on both poles, or two flagella on two poles. Also, it can be lophotrichus, just one bunch of flagella on one pole. And peritrichus, when we have flagellum around the bacteria. So the entire surface of bacteria is covered with flagellum. All of these bacteria will be motile. Most of them will be rod-shaped bacteria. But we have one more type of motile bacteria that are spirochetes. And if you remember, the motility of spirochetes is different from motility of bacteria with exoflagellum. Because spirochetes, they have endoflagellum. That means the flagellum is situated inside of bacterial cell. And if we're being more specific, these flagella are situated between layers of the cell wall. Also, if you remember, it is called axial filament. That makes the flagellum to be actually an X of bacteria. And if you ask yourself why spiral-shaped bacteria has this shape, basically because the entire bacteria is situated around the flagellum. So we have endoflagellum that is quite in the middle, and around of this flagellum is situated the entire bacteria. As a result, the function of this endoflagellum is contraction. So if we are talking about bacteria with exoflagella that are moving bacteria, they have a mechanism that could be similar to an engine that gives rotation, and as a result of this rotation, it can move. But the bacteria with endoflagellum will contract. So the function of endoflagellum actually is kind of muscle. This muscle contracts the entire bacteria, and it can move. Also, if you remind how we can detect flagellum in the lab conditions, or how can we detect movement in lab conditions? We have two ways. We have direct method and indirect method. And when we are talking about direct, indirect method, please ask yourself what it is about. Because if the question is formulated in the following way, which is the direct method of highlighting of flagellum? In this case, that means we need to see the flagellum. If the question is formulated in another way, which is the direct method of highlighting of motility of bacteria, in this case, we don't need to see flagellum, we need to see the movement. So, if we are talking about bacteria with exoflagellum, in such case we can see flagellum with some specific staining. Do you remember when we observed some bacteria under the microscope? You can even by using light microscope, you can barely see that bacteria. Anyways, it is extremely small. Now imagine that flagellum is even more tiny. So by using such kind of staining like gram staining, the mostly common one, you cannot see flagellum. You can see just bacteria, and that one will be very small. This is why for highlighting of flagellum, of exoflagellum, we apply Loeffler staining. And Loeffler staining is that kind of staining in which the dye has affinity to flagellin, that is protein that forms flagellum. As a result, it covers the flagellum more than bacteria, and it gives to flagellum a bigger volume. As a result, we can see flagellum even better than the bacteria. This is how we can highlight flagellum. So if we ask which is the direct method of highlighting of flagellum, we will say Loeffler staining. If we say which is indirect method of highlighting of flagellum, that means we will not see the flagellum itself, but we will see the movement of bacteria. In order to see movement of bacteria, we apply dark field microscopy and hanging drop smear. That means a droplet of saline solution with sample of live bacteria will be put it on special slide, will be turned upside down in order to make hanging drop smear. And by using a dark field microscope, we will be able to see the bacteria. Do you remember how works the dark field microscope? Yes or not? If you don't remember how works dark field microscope, I will show you right. Just as you can see, in any microscope, we have source of light, we have condenser, we have table for slide. Here we put the slide. We have objective, and we have eyepiece. The light is going from the source through the condenser, through the smear, through the objective, through the eyepiece, and we can see the picture. This is how it works in light microscopy. When we are talking about dark field microscopy, the function of condenser is to change the direction of the light. So the direction of the light will be changed in that way. It will pass through the slide. The main part of the light will be covered with an obstacle. but the light that will pass through condenser that change the direction of the light, the light that passes through the slide will not get into the objective lens. It will go in another direction. So since it doesn't, most of light is not getting inside of the objective, but it goes beyond the objective lens, the most of picture will be dark. But how we'll see the microorganism, as well as you should remember from biophysics, as well as you should remember from biophysics, every matter has its density. So if it is transparent matter, like air, like water, like bacteria, the light can pass through this matter. But since all of them, they have different density, when the light is passing from one matter in another one, the refraction will happen. That means part of the light will change its direction. As a result, the light that passes through the slide, will pass also through this bacteria that have different density from the density of water, of saline solution, where they are situated and where they are moving. So on the entrance and exit from these bacteria, the light will change its direction. That will give to bacteria such appearance. It can look like stars, like night sky. So the background is dark, is basically almost black, but the light that passes through this transparent matter of bacteria will change its direction and will make bacteria to shine. This is how works dark field microscopy. So the biggest problem of staining methods, if we want to see the motility, which is the biggest problem of staining methods if we want to see the motility, we cannot see before we make staining, we make fixation. If we make fixation, what happens? Bacteria dies and bacteria doesn't move anymore. It attaches to the slide. So you cannot see the motility. This is why in staining methods, we can see just the shape, just structures, but we cannot see the movement. When we apply dark field microscopy, we don't apply any fixation. We don't apply any staining. As a result, we don't need to fixate bacteria, and it will move. We'll see the motility. That's right. Let's continue. So it was introduction. It was an introduction for for differentiating motile bacteria. Now, today we'll talk specifically about bacteria with endoflagellum. That means it is, you can understand that it is impossible to apply staining of endoflagellum, right? This is why we need alternative methods of highlighting of motility. Because not every bacteria can be stained by Loeffler staining. If we take Loeffler staining and try to apply it for Spirochetes, we'll see that it doesn't make any sense because the flagella is inside of the cell wall and it will not be stained. As a result, we need to see the motility. We will not see endoflagellum, but we'll see the motility. And we'll start with Leptospira. Today we will talk about three representatives from Spirochetes: Leptospira, Borellia and Treponema. And you already can answer the question, are they gram-positive or gram-negative? Leptospira, Borellia and Treponema. Are they gram-positive or gram-negative? Gram-negative. Why? Because of the name. So all of them are making part of Spirochetes, but all of them are producing different infections. So if we are talking about Leptospira, and disease caused by Leptospira is called Leptospirosis, please keep in mind that source of infection can be rodents, wild animals, domestic animals. The mostly affected people are people who are working with bacteria, with animals, vets, farmers, hunters, and so on. People who are working directly or indirectly with animals. People who are making deratization, killing of rodents, in order to stop their spreading, in order to prevent spreading of infections caused by rodents. So this is strictly zoonotic or zoonotropoonotic infection. That means the human cannot be a source of infection. How it usually happens? An animal is walking around. The animal is infected. Through the urine, it contaminates soil, it contaminates food of other animals. Other animals are consuming this food and getting infected, getting sick, and continuing spreading the infection. Humans also can get these infections, for example, by direct contact with animals. For example, you have a cat or you have a dog. The mostly spreaded scenario is spreading through the cat. You have a cat, the cat sometimes is walking outside, having contact with other infected animals, getting home, and of course the owner has very close contact with its pet. They're sleeping together, they're eating together, they're kissing each other, they're doing the mostly weird things you can ever imagine. First of all, such people, if you have such habit to play with your pets that close, please be aware that every year you must make checkup for parasites, because probably you have some. The chance is extremely high. Another thing that could happen, you can get leptospirosis. Leptospirosis is an infection that can be transmitted either through contaminated water, either through contaminated food, either through the direct contact. Especially if you have some skin lesions. And probably you know, if you have a cat, you have some skin lesions. Because all the cat owners I know, very often they have scratched hands and other parts of the body. And they're saying, no, she's just playing. She's just playing like that. Okay. So by having extra scratches, extra traumatic events for your skin, you have more chances to get infected. And today your cat will scratch you on the hand, tomorrow or also today your cat will lick your hand in the place it scratched it. Here we have the moment of infection, the moment of penetration of the pathogen. So, as a result, bacteria will get in the body and will produce some lesions, some infections. And these infections can be very often misused with autoimmune diseases, with some allergic rashes, but basically it will have, basically it will have the classical symptoms of infection, except all of these skin lesions. It will produce fever, it will produce general infectious symptoms. How can we make lab investigation for leptospirosis? Just as we discussed in the beginning, first thing we need to see its shape, its motility, and symptoms. If we can see symptoms, we take some prelevates, some materials from the lesion. This is what we are discussing all the time. In order to make diagnosis, we need to take a sample. We take the sample in dependence on affected area. If we have skin lesions, we take the sample from the skin lesion and we are making microscopical, bacteriological, serological, molecular biological investigations. So first thing will help us is microscopy. We are trying to stain it. If we see we cannot stain it, but symptoms are characteristic for leptospirosis, what we are doing, dark field microscopy. And we can see spiral shape, motile bacteria. Also, how can we see the motility of bacteria? Cultivation, do you remember we have solid, semi-solid and liquid culture media. If we make cultivation in semi-solid culture media, non-motile bacteria will multiply. You poke the culture media in the tube non-motile bacteria will grow just inside of the it will grow on the entire place you introduce the loop. But if it is motile culture media, it will grow in the entire tube. Yes, because it moves in different directions. So this is one more way how you can see the motility, or how we discussed about Clostridium. If we put it on solid culture media and it multiplies, it makes the colony. After that, it makes a wave. It multiplies, it gets outer, and it makes one more wave. So motile bacteria on solid culture media will make colonies, and around these colonies you will see waves of extra colonies. This is how you can see the motility of some bacteria. And after we found out it is spiral shaped bacteria, it is motile bacteria, and we put it together with symptoms, we can already, and also epidemiological anamnesis. Does the person have contact with animals or not, with rodents, with pets, with domestic animals, with wild animals? If the person can describe you some repeated or accidental contact with animals, you also can suppose leptospirosis. And of course, 100% diagnosis will be made if we apply more specific methods. More specific methods is serological reaction, is PCR. If we're talking about serological reaction, it is antigen test. We are taking sample from the affected lesion, from the affected skin, from the lesion. We take the sample. We make serological reaction. Being more specific, we make sero-identification. That means we are using known antibodies in order to detect unknown antigens. The reaction is positive. We have the confirmed diagnosis. And PCR, one of the mostly precise methods of investigation. So if we are able to amplify genetical material of the pathogen, we can confirm the diagnosis. Of course, the treatment is with antibiotics. Treatment with antibiotics is the first line treatment. And also it is important not just to treat, but to take under control circulation of the pathogen. Because if it is just an accident, it is one story. But if the person has repeated contact with source of infection, that means we need to reduce this contact, and we need to reduce the contact of anyone with the source of infection, and we need to fight with source of infection. So if we are talking about source of infection, rodents, we make deratization. That means killing of all the rodents from the area. If we are talking about maybe some domestic animals or some pets, if there is a chance to treat them, we treat them. If there is no chance to treat them, we also need to kill them. And if it is some accidental contact with some wild animals, probably we need just to make other people aware that this region is not safe from this point of view. But still, there are some strategies for decreasing of circulation of infections in nature. As prevention, the mostly important part is environmental hygiene and rodents control. When we are talking about hygiene, it is very important because I don't know how it happens, but people who are having pets especially, and I want to underline it, people who are having pets, the limits of personal space are different in such people. Such people don't have any imaginary limits of personal space. If we're living together, we can do everything together. It is not normal. It is not normal. And I'm pretty sure if you wouldn't have a pet and you would see it from a side, you would say, ugh, how it's possible. That's actually disgusting. But if you're doing it, no, I know it's my kitty. I know how I taking care of it and so on. Come on. Are you sure? Even if you are washing your cat every day, I'm sure you are not. Even if. Did you see how cats are showering themselves? No? They're licking themselves from up to down. No, from down to up. Yes. From down to up. And after that, they're licking your face. That's cool. So, and dogs also are doing such things. So people should take a little bit more care about what they are doing and with whom or with what they are doing it. So if you don't care about the fact it is disgusting, at least think about the fact it can give you a very large choice of infections. And except environmental hygiene and personal hygiene, except rodents control, that is also very important. And if somebody is from rural area, you probably know that rodents are very often bothering, not just bothering, they destroy everything they find because they also are trying to survive. They also need to procreate. They also need to eat something. And they make their houses in your houses. Of course, you will not be okay with that. Also, is very important occupational safety. That means people who are working with animals, they shouldn't be that confident. They shouldn't be that sure everything will be fine. When you are used with something, you get relaxed with that. So it is very important to prevent such infections. If we are talking about Borelliosis caused by Borrelia, you can remind there is such infection as Lyme disease. And this is an infection caused by bites of ticks. Now, who is the source of infection? Because very often we are misusing source of infection with what? With vectors. What is vector?
Vectors, they are like, for example, kind of vectors which are transmitting.
First of all, they are insects.
Yeah, insects.
Insects. Second, they're hematophages. What means hematophagous? It is the insect that is sucking the blood, is eating your blood. It is hematophagus. So these insects are consuming the blood of infected animal or person and are flying or jumping or moving to another animal or person, also bites this person, and by this way infects. How we make difference between insect that plays role of vector and plays role of factor of transmission? Because some insects are playing role of factor of transmission of infection. As example, we can take a fly.
They are going to dive into the food, for example, no?
The fly will be the factor of transmission because 5 minutes ago it was on feces. Few minutes after, it is on your bread on the table. What happened? The fly had direct contact with
infection source,
with the matter that contains the pathogen. After that, it has direct contact with your food. So in this case, the fly was factor of transmission because the fly transmitted or brought the pathogen on its own surface.
yes.
When we are talking about vectors, these are insects that are consuming the blood. The pathogen can multiply inside of the insect's body, but since it is in blood, not because of it doesn't infect the insect. The insect is not sick. The insect is not infected. It just carries the blood inside of itself, and this blood is the comfortable culture. It is a comfortable media for the pathogen. So it is able to multiply here without affecting the insect. But still it is inside of the insect. So insect is coming to a receptive organism, it bites it again, and in this moment can happen reflux of this blood in the bloodstream of the person or animal this insect will bite. As a result, we have infection. This is the difference between factor of transmission and vector. Vector is all the time about hematophages that are not getting sick, but they just transmit inside of themselves in the blood the pathogen. So when we are talking about Borrelia, Borelliosis, and Lyme, and specifically Lyme disease, apparently they are also spiral shaped, they are also motile. It is also very hard to stain them by gram staining. Even if they are gram negative, it is not too easy to see them. So we apply dark field microscopy. Same thing. Different pathogens from this genus, Borrelia, and especially Borrelia burgdorferi that causes Lyme disease, are extremely dangerous because of the way of infection. You should keep in mind all the infections that are spreaded and transmitted through the blood are very dangerous and very aggressive because the pathogen will multiply much faster in the blood than in other places, first. And second, it will move all over the body. If you have a localized infectious process is one problem. If you have a generalized infectious process, if it multiplies in the bloodstream and spreads all over the body, it will produce a lot of symptoms, a lot of issues, and this is what makes such infections extremely dangerous. So, two mostly important infections caused by Borrelia is Lyme disease that is caused as well as I told by Borrelia burgdorferi, and relapsing fever. Also, it is called tick-borne relapsing fever. And why it is called relapsing fever? Because the disease has different stages in which fever will decrease and increase, and it will be very hard to control. Yes, but it is very clear to observe. Ups and downs of this symptom of fever. This is why it is called relapsing fever. It comes back again and again. It comes back. So just you think the disease decreased, and it comes back again. If the person have been walking around in the forest or in high grass or in a park, had a picnic or something, if the person found ticks on itself, it is very important to check for Borelliosis, for Lyme disease, or for relapsing fever, because the treatment is much more complicated than in classical infections, in other infections. If in a classical infection the treatment with antibiotics will last about 1 week and we're done, in relapsing fever it can take much more, even months of treatment, because the pathogen is spreading very fast and multiplies and spreads all over the body and penetrates in different tissues. So it is very important to detect pathogen before you have symptoms. How you detect pathogen before you have symptoms? After every walk outside, especially spring, summer, when you already start wearing shorts, and the chance of tick bite is higher. Just to make all the time you come back after such walks in the forest or something, make checkup. Don't you have anywhere any ticks? If you have some, it is very important, very patiently, to take it out, to not damage it, and to bring it to the lab for investigation. If there will be found Borrelia, it is the best time to start preventional treatment. If you start preventional treatment, what means preventional treatment? Before you have symptoms. So if you start preventional treatment before symptoms, it is, yes, first of all, you can prevent the disease itself. Second, even if it starts, less complications, less issues you will have. And if we are talking about mostly common symptoms in relapsing fever, of course it is fever, but not as in any infection. Yes, and again, I want to remind you that fever is everything over 38 degrees Celsius. If you have 37, 37 and 2, 37 and 5, it is not fever, it's subfebrile temperature. So, but if we have a bloodstream infection and relapsing fever and Lyme disease, it is specifically bloodstream infection. That means the pathogen is multiplying in the blood. The fever will be extremely high. And you cannot decrease fever just by using antipyretics. Headache, joint pain, loss of appetite, nausea and vomiting. Why? Because it starts affecting all the systems. It is not because of some food poisoning. Yes, if you have if you have food poisoning, you have vomiting, maybe headache, maybe stomach pain, but you don't have fever usually. In most of cases, if you have food poisoning, you don't have fever. So whenever you have very long and strong fever, and at the same time you have also on the one side loss of appetite, please pay attention. On the other side, vomiting. Doesn't make sense. I didn't consume anything. Why should I have vomiting? Because of affection of center that produces this reflex. So the pathogen is multiplying that much. It starts affecting also the central nervous system because it circulates in the blood. So it is very important. When we are talking about Lyme disease, how you detect it? In the place of bite, you can find like a halo, yes. It is called also bull's eye. I don't know why. It is just called so. So you will see this, yes, bull's eye rash. So it appears you already can you can be already scared about that. So it is the first, the mostly classical symptom. And after that, since it starts circulating all over the body, since it starts affecting soft tissues, you can see such symptoms like facial palsy or swallow knee or other symptoms like that. Something swallows and gets like very soft. So here we also should be aware. It is very important to start making investigations. If you didn't do that in the moment you detected the tick, start making investigation at least now and start treatment as soon as possible. As faster you will start the treatment, as less consequences you will have. Lab investigations, of course, will be more or less classical for all spiral-shaped bacteria. But the mostly common one will be serological investigation. Since we very often we detect this infection already in the stage of disease, it is very important to make it as soon as it possible. This is why we probably will start with serological investigations or with PCR. And meanwhile, we already started the treatment. We also can make cultivation of this bacteria. So,
Doctor, but so for cultivation, what medium we use for cultivation?
for cultivation,
Oh, thank you.
yes. It makes sense because it gets in the bloodstream. So blood agar will be a very proper culture media for you. Okay.
Thank you.
Treatment, of course, classically, as any antibacterial, as any bacterial infection is treated with antibiotics. But it is very important that it is not simple. It is not simple infection. It's bacteremia. That means we have a lot of bacteria in the bloodstream. That means we should apply specific treatment, and we should apply the long treatment that could last up to 1 month. 1 month. So it can be between 2 weeks, 2 and 4 weeks. And as prevention, the most of all prevention of borreliosis, prevention of Lyme disease, relapsing fever, will stay on tick avoidance. That means you are doing your best to avoid getting bitten by ticks, or if you've been bitten by ticks, you are making your best to make all the investigations in the very beginning. Because it is really difficult, I would say impossible, to reduce ticks population in nature. There are some insects, there are some living creatures, you cannot control their multiplication. This is why the best prevention will be finally avoiding being infected, avoiding being bitten by a tick. As a result, you will avoid being infected. And using repellents, using proper clothes when you are going for walks in nature, and afterwards very patient checkups. If you've been, for example, if you've been for a picnic somewhere with your friend, when you go home, when you come home, you help each other to investigate yourself, because sometimes they are not getting just on legs. Also, they can be on trees, on bushes. So it can fall on you. It can get anywhere. Now you're starting imagining, yes? So help each other to check. You can find it here, you can find it here, you can find it all over your body. In the axial space, on hands, on chest, on back. So you will not every time you will observe it, you will find it by yourself. So if you've been with someone, ask your friend or your colleague or your relative, someone, to investigate your skin better in places you cannot see. For example, behind, on the back, behind ears, and so on. If you will find it immediately, there are less chances to get infected. There are more chances to get the treatment on time. And the last one. The last one is Treponema. It is a pathogen that causes, as well as you should know, it causes syphilis. It is the last spiral-shaped bacteria for today. And specifically Treponema pallidum This is the name of pathogen that causes syphilis. What is important to keep in mind about Treponema? If we're talking about, we already know its features, its shape and stuff. It is important to know that Treponema cannot be cultivated on culture media. We are not applying culturing of Treponema. Like, it is possible, but almost impossible. So it is not the common method of diagnosis. The mostly common method is microscopy, serological reaction. Okay, let's start with the symptoms. First thing we should keep in mind, it is STI, sexual transmitted infection. That means it will affect people with multiple sexual partners, non-permanent sexual partners. And it is very important to avoid such contacts. What is also important to keep in mind, people who are getting sexual transmitted infections usually don't get just one. Usually it can be together. Gonorrhea, syphilis, some fungal infections, some skin infections. Because these are people who don't really care about consequences. These are people who are thinking just about here and now, how I feel, what I want, and so on. Low level of responsibility. And if such people have low level of responsibility, of course, if you don't care about yourself, probably you will not care too much about others. Such people are very sick. Such people are making sick others. If we're talking specifically about syphilis, you can observe it produces such lesions we call ulcers. And by what is specific such ulcer? It is painless. Why it is painless? Because Treponema is producing specific toxin that has a kind of analgesic effect on the wound. So the person who really don't care could even ignore such symptoms because it doesn't hurt. Why should I care if it doesn't hurt? If it would hurt, maybe I will do something. But if it doesn't hurt, there is no problem. And since syphilis has different stages, such ulcers will appear. After that, they will disappear. They will close. They will open. Not a big deal for such people. And also, it can give such rashes. Not just in genitalia. This is very important to know. For example, this ulcer you can see is on the forehead. Some of them will be on genitalia or around genitalia, and some of them will be in very random places on your skin. Hopefully not yours, yes, on the patient's skin. So, syphilis can affect what is also very important and very dangerous about syphilis. Syphilis doesn't affect just those who are guilty. People can also affect a child. If a woman is pregnant and she's getting syphilis, it will definitely affect its child. So it is called congenital syphilis with vertical transmission. Vertical transmission, that means transplacental transmission of syphilis. And it is very important to keep in mind that if the baby, if the fetum before the birth got any infection, it is already lifelong disability. If a fetus before the birth passed through infection, it is already lifelong disability, because in the process of development of different systems, of different tissues, of different organs, the organism of fetus passes through the infectious process that will damage some functions or some organs or some systems. This is why it is very important first to have planified and controlled pregnancy, not by an accident. And second, if you already did that, it is very important to take care on your health, because it is not just your health. It is very important. So, since we don't apply any cultivation, any culturing investigations, first of all, it is not a big deal to understand by symptoms that it is syphilis. This is why the fastest method and the easiest method of investigation is serological investigation. That's correct. And also, if we have cases of neurosyphilis, it also can affect, including babies, congenital syphilis. Of course, it is very important to make investigation of CSF. And just to make sure about the pathogen, we can apply same dark field microscopy and to confirm or infirm the diagnosis. Treatment, fortunately, is very common and not that complicated. The mostly useful antibiotic is penicillin. But since we have antibiotical control, still it is very important. The treatment should be set by doctor. It is very important, because it is not enough just to treat. It is very important to find the source of infection and stop spreading. Because sometimes the person is aware about ways how he or she got infected, but sometimes it can be the person who didn't know. For example, wife or husband who've been cheating, and another part didn't know about them. So it is very important not just to treat, but to detect the source in order to solve the issue, to solve the cause, not just the infection. So, as prevention, just as we discussed about gonorrhea. Which is the best prevention is having the only lifelong sexual partner. The best option. It is very important from both sides, not just from one. And working on responsibility of the society. That's it for today.